During the early years of Christ Community, Rick Donlin called me and said, "Robert, I want you to get involved with Christian Community Health Fellowship." Well, hey, I was busy, and really busy, and stressed out at some levels. And Rick said, "No, this is really, really important. This organization is positioned to be a prophetic voice for the gospel, to call God's people back to taking care of the poor in the United States." I said, "Well, Rick, if that's what it's all about, I'm in. Let's do it." When we first got involved with CCHF, it was just through a small group of us going to one of the conferences. We experienced the worship there, we experienced the breakout sessions, and came home energized.
Well, CCHF last year rejuvenated me in the fact that I got to see that we aren't the only people doing this. There are other people who feel our burden and our desire for people who can't afford, health insurance or quality health care to get it, for the sake of knowing Jesus, that being the end.
Encouragement, to know that other people around the world from all aspects of life are doing the same thing that we're doing here at Christ Community Health Services.
We've been able to write for grants that have allowed us to pay for our entire staff to come to the conference. If you ask anybody walking the halls of Christ Community Health Services in Augusta, they'll tell you, "I can't wait for the conference." When our local health department was looking for someone to provide disease management for HIV positive patients through the Ryan White program, they approached us. But through the encouragement of organizations that we knew who did disease management in similar populations that we had relationships with through Christian Community Health Fellowship, we stepped forward and started a Ryan White disease management HIV program.
Last year at the CCHF conference, I went to the pre-conference HIV seminars. I am new to HIV care within the last 2 years, and I did get some training in residency, but CCHF was able to provide that for me, and so I do appreciate being able to be a part of that.
When we got started, we knew we were going to have challenges financially to do all the things that we wanted to do. We'd heard about this program called the Federally Qualified Healthcare Program.
When I went to CCHF for the first time, I was excited, but when I got there, what I discovered was a group of people that were laying down their lives to live the gospel of Jesus Christ through healthcare to the poor. And through that, we met consultants of like mind through their wise counsel and being able to have conversation with them and other executive directors and staff throughout the country who have FQHCs that are faith-based. We were able to have confidence in that process and be able to fill out our application without losing our mission.
I know you're busy, and I know your staff's busy, and I know things are tight financially, and I know your resources are scarce, the resources of time, the resources of money, but this has been, for us, a vital investment financially and a vital investment in encouraging our staff. And I would encourage you in any way that you can to sacrificially give of your time and give of your money to remain connected to the Christian Community Health Fellowship and to encourage it and to become part of this prophetic voice to God's people.